question. And before we discuss how digital CBT can save payers money, let's discuss what a digital CBT is. So there is an emerging area of what's called digital therapeutics. So it is a therapeutic. They are designed to help treat or manage symptoms or monitor disease, but it's delivered in a digital application. Now, different organizations have slightly different versions of that definition, but essentially that's what the goal is. A digital cognitive behavioral therapy is one that is designed to deliver that therapy to a patient, but using a digital application or platform. And it can help, it provides several advantages over traditional CBT for a payer. First and foremost, it can help to address some of the barriers that I talked about earlier. If patients have transportation issues or live rurally, for instance, where they have a lack of clinicians that are trained in CBT, they can now access that care and they can do it from their own home. In the era of the pandemic, that's actually been very popular because patients don't have to have that in-person, face-to-face interaction for CBT. So it's not only safer in that instance, but it's just more easily accessible. It also provides a way to address additional barriers. So in some instances, for instance, if there's a language barrier, now it can be delivered in the language the patient actually speaks. And it can also help to avoid complications of stigma. Some patients with chronic insomnia have a real stigma about seeking out treatment. In the instance of CBT, digital CBT, it can be done in a way the patient feels a lot more comfortable. It's done in their own home, and so can help to minimize that stigma. From a payer perspective, not only can digital CBT help address those barriers, but it has been shown that it can help improve clinical outcomes as well as reduce overall healthcare costs and those indirect costs for employers or payers of healthcare. So when you combine all three, those are really great ways to not only improve patient care from a payer perspective, but also help payers to save money. Several studies, particularly recently released. One very interesting one was by Pear Therapeutics. So it's the first FDA-approved digital therapeutic for CBT and chronic insomnia. And they had some really interesting results within their data and their studies that really helped to show not only are they improving health outcomes for those patients, but they're also helping to increase productivity and lower overall costs for payers, for employers, because of those improvements for patients. I think you're going to continue to see more studies in this avenue. I think not only in terms of CBT as a whole, but particularly digital CBT, and more broadly around digital therapeutics with the pandemic, with the need to provide care in more virtual settings. We're starting to see more investment in those areas as a whole. So I think you're going to continue to see more studies that focus on improving health outcomes using things like cognitive behavioral therapy, and particularly using things like cognitive behavioral therapy that can be delivered in a digital format.